Hello everyone, Dr. Peter Stapleton here, and I just wanted to give you a lay of the land and an update on the EFT, Emotional Freedom Techniques or Tapping research that was published in 2024. So I've done a deep dive into the research and the publications, purely just looking at EFT for the last 12 months, and I wanted to let you know what's emerging in that field. Now, there has been a distinct theme that stood out in more than a dozen studies that have been published and come out in peer-reviewed journals, and this has been a theme of EFT or tapping being used in medical and hospital settings. So at least 10 of the studies that I'm about to give you a bit of an overview of were done in those settings. Now, everywhere from Iraq to Malaysia to New York City. So very exciting that our medical fraternity and establishments are embracing EFT. So before we jump into that, where's the research at here in Australia at Bond University? What did we do in 2024? So we have absolutely completed our primary school trial where we looked at not only a daily meditation study for primary school children aged 4.5 to 12 years, but one subgroup of that actually looked at engaged in EFT videos. So we were able to compare, and they were year one only, so 5 years of age. EFT versus meditation. I can tell you that paper has just been submitted in January 2025, so it should come out this year, but we did finish that study last year. We also finished our replication study, EFT for vision impairment, which was a direct replication of Dr. Carol Look's study. She had run that almost a decade earlier, but we replicated that. I can absolutely tell you the outcomes are fabulous. We're still doing 6-month follow-up. That paper should be submitted by the end of 2025. Fabulous outcomes coming out there. And we have also submitted for publication a single session study of EFT or tapping for forgiveness. So that was a collaboration with Luther College in the US and Dr. Lauren Toussaint. So I can absolutely tell you again that that single session achieved significant outcomes for our people who are involved. They will all come out this year. So we had a year of trials, and obviously now we have a year of having those being published. So back to the research for 2024. General theme, hospital settings. So let's start just by talking about some of the hospital studies. All of the links for these studies are below, so you can actually go and read the whole papers. One of the first studies that came out was about reducing anxiety, obviously using EFT, in open wound patients. So this is an interesting one. It was a literature review that looked at 10 studies. Now, they did include spiritual EFT as well as EFT, and found enough studies, 10 had been published, that met their criteria, that showed EFT can reduce anxiety in patients with open wounds in hospital settings. It didn't actually matter the type of wound, whether it came from a burn, a fracture, or a surgical wound. They found that it was absolutely significant. So they looked at 10 years worth of research, 2013 to 23. So there you go, there's the first study. Another study was done on stress levels in stroke patients. So 48 patients who had had a stroke were allocated randomly to an intervention, EFT, or a control group, so random allocation. Significant changes in the stress levels before and after a 6-day intervention. So that was with EFT. So those 6 days obviously were enough to result in a significant reduction in stress levels. And in contrast, the control group had no significant change in their stress levels. So again, another area that we haven't seen much research done in EFT, but obviously stress we have, but in that particular population, stroke patients benefiting. So that was great. The link is below to read the whole paper. Caregiver patient study, so anxiety and caregiver burden. So we do know that caregivers are a unique group that do suffer when they're caring for family members. So they were caregivers of patients with heart failure. This was done at an Iranian hospital. So we had 91 family caregivers who participated in this study. They were assigned, again randomly, EFT or a control group, and they had 6 sessions of EFT. So the findings showed, and the authors said, that the EFT group had a significant improvement obviously in reducing anxiety, and it significantly reduced the caregiver burden. So in the way they measured that amongst the family caregivers. So again, another area, and we see this come up in quite a few studies of carers, so EFT being of great benefit to them. The next study, number 4 here, is EFT to reduce anxiety in patients, again, sticking with the hospital, with gangrene wounds. Now, this was due to a link to diabetes. So in the paper, the authors talk about gangrene being a link, obviously, to patients with diabetes. It was done in Indonesia. The patients only had 3 sessions, and the authors say that the significant decrease in anxiety using EFT was beneficial and obviously something for them to explore. So again, gangrene wounds. The next study then done on patients before surgery. So it was done on surgical fear and anxiety. It was a randomized controlled trial, so that's obviously using random techniques. And this was done on surgery fear for 112 patients. Again, half and half in EFT versus control in Turkey, so in a hospital setting. So it showed obviously the average scores there of the EFT and using surgical fear questionnaires, that the EFT group had significantly lower fear scores, and it obviously reduced their subjective unit of distress score by 54.4%, nearly 55%. After the EFT for obviously their surgery worries, their fear and anxiety. So again, great to see that being embraced in Turkey. Next one done on EFT for early pregnancy. This is one I can relate to. In nausea, vomiting, severity and anxiety, and again, it was a randomized clinical trial. I suffered strongly with nausea during my pregnancies. So I did tap at the time, so you'll be pleased to know this point here, often associated with nausea. So I did a lot of that myself. This study, 131 pregnant women, again, randomized into EFT and control groups. They were between 6 and 36 weeks of their pregnancy, and they were at an antenatal clinic, again in Turkey. Participants randomly allocated to those 2 groups. The EFT group received a session of EFT at each visit and completed 2 sessions at home as homework. So 2 and 4 days after their first visit. The control group had 2 visits a week to the antenatal clinic and completed all the assessments but did not get any EFT. So 55 women completed the study. Now, EFT significantly reduced anxiety between the baseline, the first session and the second session, and the fear of delivering their baby, worry about having a handicapped child, concern about one's own appearance, so body concern, and total pregnancy-related anxiety. So that was all significantly decreased, and again, only between the first and the second session. The control group had no reduction in pregnancy-related anxiety, so they didn't have any change whatsoever. The nausea, vomiting sensation was reduced in both groups attending the antenatal sessions over the 2 sessions that they had, but the EFT group had significantly lower nausea intensity when they actually asked them to rate it. So whilst both improved, the EFT group, and I can absolutely tell you it was something that I used a lot during my pregnancy. Right, where are we? So that was number 6. The next study that has actually been completed again in women with pregnancy was EFT on the fear of childbirth. And this was done on women who had already given birth once. So not a first pregnancy. So women who had already given birth once, and it was a randomized controlled trial. So 116 women in Iran. And these were randomly allocated, the women into EFT versus the control group. And the EFT group received daily tapping, for 12 weeks. So the group had, of EFT participants, the women, 10 people maximum in a group. They were asked to use EFT daily at home, and they were followed up weekly over the 12 weeks. So they were sent 3 audio files a week as reminders and got phone calls from the researchers. So they were asked daily to do that. Now, after the 12 weeks of daily EFT, the fear of childbirth in the EFT group was decreased from, to give you some scores, 49 to 40, and it was statistically significant. The same group, the control group, they actually had an increase in their fear of childbirth. So that was not good for that group, but increased from 49 to 52. So that was actually statistically significant as well, that they actually got worse in their fear. The fear of childbirth after delivery. So they actually followed up these women 2 weeks after delivery from wherever they were in their journey. The fear of childbirth delivery in the control group was higher than the EFT group. So when they went and checked in on them afterwards, they found that that fear in the control group was actually still significantly higher than the EFT group. So lots coming out in the pregnancy area, which is fabulous to see. Now, staying in this same theme of mums and bubs, the next study was EFT for postpartum depression, stress and anxiety. So post childbirth, depression, stress and anxiety, which can affect many women. So 11 mums were attending a lactation clinic, so breastfeeding clinic, and they screened positive for postnatal depression and anxiety. Again, this was done in Iran at an Iranian clinic. So they were there for breastfeeding worries, but obviously being tested and found to meet postnatal depression. So they were given 8 one-hour group EFT sessions. So they were offered over 4 weeks, the tapping. There was a statistically significant decrease in depression, anxiety, and perceived stress in that 1 month after EFT. So absolutely having an impact there. So the researchers in this study really make the point at the end that the mental health burden on women and medical systems of postnatal depression, obviously EFT could be quite a tool there in that postpartum period to help women, in this new phase of life. So another great study coming out to support mums. Again, we're staying in Iran for the next study, and this one was done, again, in our hospital settings, but the effect of EFT on test anxiety in paramedical students. So this was, again, a randomized controlled trial, so the quality of our trials being published in EFT are outstanding. So these were students from the School of Nursing and Midwifery. So we're staying, again, still in that pregnancy area, but they were doing paramedical science, and they were enrolled between their 2nd and 8th semester of their study. So they'd already done first semester, so they'd already begun their degree, 2nd to 8th, so somewhere in that. 30 students assigned, 30 into EFT, 30 into a control group. They had 6 online sessions that lasted 45 minutes once a week, so 6 weeks there. The control group didn't get any intervention. After the intervention, so this was about their exam anxiety being tested, obviously on medical knowledge. The exam anxiety in the EFT group significantly decreased from a severe to a moderate range, and it was statistically significant. The anxiety in the control group did not decrease into that moderate range. The other analysis that they did showed that the difference between before and after was significant as well for the EFT group, which was fabulous to see. We've had quite a few studies over the years done on test anxiety, but this one done for our hospital students. The next one, again, we're staying in the hospital setting. EFT for pediatric emergency department staff. So this one being done on staff working in the pediatric emergency, so our little ones. This was done in COVID. It was done during the pandemic, and it was a pilot intervention, so it was being tested. So this one was a 10-minute, very short, EFT tapping session done on the psychological distress of the pediatric staff in these emergency departments, and during a pandemic, so obviously quite stressful. 50 pediatric staff They were nurses, doctors, interpreters, technicians, and other workers. So they were across the field that worked in that department. Most were registered nurses, 67%, or nurse managers. So just to give you context, and this one was done in a New York City teaching hospital. So each session of 10 minutes had 3 to 5 staff. So they were obviously, with the lead facilitator, grouped and taught 10 minutes of tapping. They filled out questionnaires that were based on trauma exposure, so their response to trauma exposure. And there were 7 different items that were measured in that, which I'll tell you about in a minute. So significant reductions in 6 out of the 7 items that were studied. So these were stress, it's obsessive and intrusive thoughts, feelings of pressure, loneliness, emotional and physical pain. They were all statistically and significantly reduced after 10 minutes of tapping. The only one that didn't change was professional satisfaction. So having a look at obviously that level, and I'm guessing working in that kind of field and unit within the pandemic may not have been top of mind for them. So it's interesting when I looked at the clinical scores, because I always like to know, okay, statistical significance is one thing, but what about the clinical scores? That professional satisfaction before they started was actually rated moderate. So it was between moderate and very much. They were already satisfied with the work they were doing. So there was no statistical difference there, but to me, it was quite high to begin with. So a 10-minute intervention, as we know, 10 minutes of tapping can make a difference. Coming to the last couple of studies now, stepping away from the hospital setting, so just a couple more that were run. Another study published, a pilot study that was actually done on post-traumatic stress disorder, so patients who were diagnosed, 30 patients, weekly EFT for 5 weeks. We do know between 6 and 10 weeks has been demonstrated for PTSD. 96.7%. The interesting thing about this study, before I tell you the statistic, was they looked at compliance, which not a lot of studies have reported. So 96.7% of the 30 patients showed 80% compliance to the EFT. So it's good to know they turned up. And 86.7% completed the whole 5 weeks. So even better, quite good scores there. So again, the score or rating of PTSD symptoms decreased significantly after the 5 weeks. They had large effect sizes, which we know is important. And we know then it's not due to chance and things like that. Fabulous outcome. And let me just see, just sneaking in at the end, right towards the end of December 2024, a fabulous colleague at the university in Las Vegas, University of Nevada, Professor Greg Brown, actually published a study on the back of a 2023 study. So this one looked at a comparison of EFT against AIT. So AIT you might know as advanced integrative therapy. So Asher Clinton developed this in the 1990s. So just a little bit of an overview of AIT. A form of energy psychology, incorporates element from Ayurvedic traditions and looks at energy flow through chakra points or energy centers in the body. So rather than tapping, hands are held on certain chakra points and specific phrases are said. So the original study, published in 2023 by Greg and colleagues at the same university, the original study looked at subjects with a single memory, and they didn't talk about the memory details to the practitioners, so either EFT or AIT, and these were randomly allocated. And they looked at a single incident unrelated to family, but middle to late childhood, that when recalled, the memory still provoked a negative emotional response, and it had to be 3 to 5 on that SUDS rating scale. So they didn't have to talk about the memory, but EFT being used or AIT being used for one of them. Now that original study showed that particular intervention, both interventions led to a significant drop in SUDS over 4 out of 10 to 1 out of 10. So that was excellent. No differences between the mean scores there. They looked at HRV amongst the intervention arms, but basically showed that AIT and EFT were comparable, which was great. Now, the study that came out in December 2024 showed a 6-month follow-up. So the studies have been published in 2 separate papers. So the original study had 72 participants and 51 of them completed the follow-up. So about 71% completed 6-month follow-up. So this paper is on that. Always good to know, how do these interventions last? So again, they got the questionnaire and it asked them to recall the memory that they actually did the AIT or EFT on in the original study. And they asked them to report their current intensity of emotional activation. So they asked them that subjective unit of distress. So at 6 months follow-up, the study found no differences in SUD scores between AIT or EFT, suggesting both therapies, both under the umbrella of energy psychology, may be equally effective in obviously getting a reduction there in that distress. 43 participants, which represented about 85%, accurately recalled which treatment group they were assigned to. So again, interesting for us to look at from an apex point of view, that terminology in lots of these energy psychology modalities where people can't remember what it was that they did. So this study was pretty good. It had 85% remembering which group they were in and what it was, the technique that they did. So both of them have maintained low SUD scores and their historical SUD scores, so back at that time of the memory, were not significantly different. So further supporting that maybe these 2 interventions were achieving the same outcome. When studies show those kind of things in the same field, it gives people options. It's not necessarily that one modality might be better than the other, but if they're both achieving something at a similar level, it's great to have options for people. So it's fabulous to see Greg Brown and colleagues really doing some really robust research in the AIT area. And obviously we love it when lots of other energy psychology modalities have science and research to back them. So again, if you don't feel like tapping one day, you might want to do one of the other techniques instead. So that's a wrap for 2024. They were the majority of EFT. What I haven't shared with you that in my research deep dive into Google Scholar was that there were more than that number of studies that were published on spiritual EFT. So a variation of clinical EFT, sometimes using spiritual phrases and prayer, sometimes using different aspects of movement, music and things like that. As many studies, if not quite a few more, published on spiritual EFT in 2024. So absolutely go and have a look at that research as well. All of the links are below. So please share this with anyone that's wondering. What really struck me out of 2024 was the fact that the majority of these studies were 1, randomized clinical trials, and 2, done in medical settings, particularly done in hospital settings for a range of different patients and conditions. But again, they were all saying the same thing. So it's not just proponents of energy psychology and EFT that notice it. People delivering these trials are reporting the same outcomes. We keep hearing statistically significant reductions. So amazing to see, so much done. So I look forward to coming back to you after 2025 and sharing where we're at now and exactly what's coming out in the field. And maybe we'll see another theme, maybe in the same area, maybe a different one. It's been a joy. Look forward to sharing what we do next.